This is part three of our three-part series around probate law, specifically for Ohio. And that this third part, really, a lot of what I'm going to talk about is in force or in place in Summit County, not necessarily as robustly in other counties in Ohio, and in honesty, not as robust necessarily in many places around the country. And I'll explain that as we go forward. Let me just reiterate. So again, I've got no disclosures. I still want to thank the same individuals who really are part of this, excuse me, both at the local level, but also the top two here at the national level, working on assisted outpatient treatment. So let me just reiterate the first two talks for about 60 seconds. So it often starts with a pink slip. That means somebody is held for up to 24 hours for an examination, and that examination makes the decision, send them back to their residence, voluntarily admit to a hospital, or involuntarily admit to a hospital. If they're involuntarily admitted to a hospital, and once they get to that hospital, the hospital has 3 court days, so not 72 hours and not 3 days. It's 3 court days. And within those 3 court days, they have to make the same decision. Let the person sign a voluntary, send them home, or do an affidavit so they can keep them longer under civil commitment. So if they do that affidavit within 3 court days, it goes to the court. The court then has 5 court days within which to hold a hearing. Most areas, Summit County included, have a hearing every single week on the same day. Thursdays actually seems to be common across the state. So that is what we do in Summit County, except Thanksgiving, it's on the Wednesday before. So like clockwork, they can do that. So within those 5 court days. And then the civil commitment hearing will say that the person can be held for up to 90 days. In Summit County, when the person is released from civil commitment, which is obviously long before, from inpatient civil commitment, long before 90 days, that's very rare, probably 10 more days. The remainder of those 90 days, so in that 10-day hypothetical in the hospital, call it 80 days, in Summit County, they automatically go on to assisted outpatient treatment. And so it used to be called outpatient commitment. As this caught on more nationally, it has now been called assisted outpatient treatment, which at least gives a better sense of what the goal here is. The person's still under commitment, but they don't have very many strings attached, so they can go to work. In fact, we want them to go to work. We want them to stay in school. We want them to keep their relationships. We want them to live where they were living, or maybe a better place if that was found while they were in the hospital and so forth. So it really is meant to be a source of support for the individual, albeit under a court order. So it really, and it doesn't work, as you see here, if you don't have services, right? You don't want to civilly commit somebody, put them out on assisted outpatient treatment, but they have no agency. And of course, we do have a lot of rural areas in Ohio and across the country that may not have ready access to all the resources that are needed to make AOT effective. So that's just one caveat to what I'm describing today. So the concept here is we took the person's civil liberty away, if you will, all with using due process, 14th Amendment rights in place. They're released to the community, and our hope is that we are now giving them back their autonomy permanently, right? The goal is not to have them end up in the hospital again, not to end up in jail. We want them to keep their autonomy. And so this period of time of the up to 90 days or whatever remains in the outpatient setting is to help build those supports and accomplish that. In Summit County, we've determined that the best way to do that is for all of these individuals who come out of the hospital. That could be any hospital in Ohio that they come out of. Most commonly, that's SUMA and Cleveland Clinic Akron General, but it might be North Coast, which is our local state hospital, or regional psychiatric hospitals, they now say. But it could be any hospital around the country, really country, but probably state in particular. And so we give them the supports, and they virtually all end up as excuse me, patients of community support services, CSS. And we have actually allowed other agencies to try this out, but it takes a lot of staff time. And honestly, they've all cried uncle. So the only exception is every once in a while, somebody on the first episode psychosis team, which is based at Child Guidance Family Solutions in Akron for Summit County, those individuals also can be on AOT if they go through the process I've described in the first 2 lectures. and they will maintain those individuals. They do have case managers. They do a great job with First Episode. As you probably know, they were the first episode team in Ohio, so they do a lot of good stuff there. And Judge Stormer was the first judge in Ohio to institute our version of assisted outpatient treatment, which I'll talk about. So we've got a lot of firsts around probate law here in Summit County. So it really is, I like this graphic because it kind of represents what Judge Stormer is doing, but also what we're trying to do as a system, really working together to help people stay in the community and keep their autonomy. So most of these individuals, the issue is anosognosia. They don't have insight. They can't understand, is a better way to put it, I think. They cannot understand that their own brain is ill, right? So it's like their brain is, how do I know I'm ill? It's very hard for the brain to know that it itself is having an illness. So that's really where anosognosia comes in. And so we put into place assisted outpatient treatment, and there is some flack around this because many people think it's toothless. Judge Stormer found this graphic. I think it's great. It's not mental health court. So you're not saying, look, if you don't comply with the mental health court rules, you go to jail, you might even go to prison. There is no contempt of court. If you don't show up, there's none of that. You can't put them in jail. And Judge Stormer used to be on the criminal court bench years ago, so she understands the differences here greatly. And you can't forcibly administer medications in the community. That is, if it exists in the country, I'm not aware of it being used with any regularity. I think I mentioned in the second lecture that the society sees holding somebody down and forcing an injection of a psychiatric medication on the person as worse than putting them into prison. So that is not something that's being done. And if it was ever done, it would not be done lightly. There would probably be all sorts of legal action around it to make sure that it was truly the appropriate action for that person in the community. It can happen in an inpatient setting. And again, Ohio is one of the toughest as far as requiring a lot of clinical opinions, 4 to be exact, before a judge then makes a final decision. So very restrictive. Very few people get onto civil commitment. Very few people end up with treatment over objection, the nicer phrase for forced medication. And of course, it's really a small group who end up on assisted outpatient treatment. Even in Summit County, where we are robust about this, and we've been doing outpatient commitment for something close to 30 years now, the assisted outpatient treatment, which adds in some court time, which I'll describe in a few minutes here, it's a tiny group of people out of 542,000 citizens. Our peak, I think, was 200 people. We tend to run in the 160 to 180 range of individuals at any given time. And that sounds like a lot of people, but it's not. Out of 542,000 citizens, it's not, even if you only consider the 50,000 individuals in the county that touch the ADM system of care. Even 200 is not if you do the math, it's point something percent. So very, very small. We believe from the research that the reason that the AOT works well, especially when we do it the way we do it in Summit County, where they actually go in front of a judge, in this case, Judge Stormer personally, is literally in the research called the black robe effect. And I think that the way to understand this is most individuals, short of maybe intellectual and developmental disabilities, most individuals who have a brain disease, it doesn't come to fruition until later in life. Even if it's at the age of 6, most commonly, of course, it's older adolescents, younger adults is the most common onset of most of our most serious illnesses, particularly the serious and persistent mental illnesses. Most of us by that time have already established an understanding from society of who the authority figures are. Generally, it's people in uniform, law enforcement, paramedics, astronauts even. And by a certain age, we even understand a judge has authority, and the judges wear black robes, not to be confused with the other problem nowadays, which would be Harry Potter. So we probably have some confusion at a younger age than we might have when I was a child. So that really is important. So the judge really is a symbol of authority. We tend to know to comply with judges' orders. We tend to comport our behavior in front of a judge. And so that helps this process. And what I'll describe to you how it works in Summit County, because you'll see that when the person suddenly, and sometimes it's an aha moment the first day in court, they realize the judge is actually paying attention to them personally. We believe, and the research would suggest this, that actually is a positive thing. It's a support for the person, even if they don't believe they have a mental illness or really can't understand that they have a mental illness. So it's very, very important. And by the way, I have here that it works in the treatment system. So the point here is, so CSS, they're clinicians, they're psychiatrists, they're nurse practitioners, they're nurses, social workers, LPCCs, et cetera, that work with this group. They also understand that the judge has authority. And so that helps them. And also they can say to an individual, sir, ma'am, we're trying to help you here, but understand that we also have to report to the judge on this, right? So there's power in that, I think, to free up some of the concerns that sometimes the patients, clients, consumers, whatever your preference is there, have. So although there's no jail and no fines, there are consequences. So we call this New Day Court, coined by Judge Stormer. Actually, we considered recovery court, but that is pretty commonly used for other types of courts. So we went with New Day Court. And we do have status hearings in front of the judge, and I'll describe that in a moment. And that helps the individual and the case manager who's in the courtroom. Again, that's why CSS tends to do this. They have a lot of case managers as part of the design of the Summit County system going way back to 1989. We've had this. And the judge can help the team, the clinical team, decide, is this person, do they need to go back in the hospital? Do we need to somehow alter the treatment plan? And the judge can, in fact, order a pickup order with usually a sheriff's deputy, because she's a county judge, so the county has the deputy sheriffs. So the county deputies, and literally that can even happen in the courtroom. And of course, the goal is not to have to re-hospitalize. We'd rather do that early than have them end up in a situation where they end up in jail. So in Summit County, we used to not have any of these status hearings. In January 27th, actually, of 2016, with a lot of work that we did in 2015 as a team, we do have quarterly meetings of our probate system, including our hospitals, social workers in the key hospitals, and so forth, and the court, of course, ADM and CSS. We meet regularly. We talk these things out. We created New Day Court. And the concept here was to help both CSS in particular and the patients, and sometimes their families, they're welcome to come to court if the person wants them to. And they then are seen by the judge with support from the case managers and often others. ADM usually has at least one person there and so forth. And there may be others there from some of the other agencies who know these individuals and also want to be a support. So we, of course, when people are civilly committed, and when they remain on commitment in the community, they're actually committed to an ADM board. So they're not committed to a hospital, which is why it's not so hard to move them to assisted outpatient treatment in the community, because they're actually committed to, in my scenario, the Summit County ADM board, but it could be to Dr. Mader's board or somebody else's board around the state that could be committed to those boards. I mentioned CSS, I mentioned first episode psychosis at Child Guidance Family Solutions. Those are really our two key partners right now. The very strong heavy half here is CSS. But we do have to work with our community-based providers. Again, this is useless without treatment. The hospitals, of course, are the linchpin before somebody comes out. Law enforcement, NAMI, actually NAMI's always in the courtroom for these hearings as well. They can talk to the family. They can help make sure everybody is getting what they need. And now we've added, I don't have it on the slide, but there are peer support specialists involved in these systems, which of course are a great addition. So people with lived experience can help individuals say, hey, I've been there, done that. And in fact, I'll show you a quick video here in a few moments at the end of somebody talking about this. Actually, not even from here, from Bear, Texas, just to give you a flavor from somewhere other than Summit County. If you're interested in seeing more stories of hope, they are on the ADM board website. Although my caveat is we're in the process of updating the website quite heavily, and it may not be available today. I haven't looked at it this morning. They have to keep taking it down to add things and adjust. So again, the concept here is at CSS, they create a treatment plan. It's all clinical. The judge doesn't really play into that. She may ask for other things to be part of it if the person isn't doing well when they come in front of her at New Day Court. And then we constantly, we're very, very much daily, have back and forth information between CSS, the court, and ADM board. So we have people, a person at each, plus then others like myself in the background, watching this flow at least every weekday, making sure that the hearing dates are right, making sure the person's doing well. So there's a lot of a positive to this because the person's getting more resources because we don't want to do this without the resources. So I will mention that it is possible in Ohio, and I'll show you a slide on that in a few minutes, to actually have somebody be put on assisted outpatient treatment as an outpatient, as opposed to going into the hospital first. That has not gone well in Ohio. That has been tested. We've probably tested about once a year for the last 6 or 7 years, and virtually every time, by the time they come to the attention of the court, the person's very ill. They've ended up hospitalized. That's literally what has happened in all of those cases. Is it effective? It is very effective, and let me describe the scenario. So obviously the judge in the courtroom for AOT is sitting on the bench, so she's a little bit higher up than the individual. Again, I'll say Mr. Jones, as I always do. Mr. Jones comes in, and the judge is very good at this because she also started the first mental health court in Ohio a long time ago. So she's very good at this for decades now, of having this kind of conversation with an individual with potentially mental illness symptoms even today. And so, Mr. Jones, how are you doing today? He'll give her his quick summary. Again, it could be he, she, they, whoever's in front of the judge. She has a cheat sheet. They can't see that because, again, she's a little higher up on the bench, right? They can't see the piece of paper. The cheat sheet is created, and CSS puts information on there, very basic information. Did he go to his Did he go to his required psychotherapy sessions, et cetera, based on the treatment plan? Is he taking his medications? Is he going to 12-step meetings if that's part of the treatment plan, et cetera? So judge may say, well, Mr. Jones, I want to commend you. I understand that you have been taking your medications regularly. How are you doing with those? He'll talk for a minute or two. Then, Mr. Jones, I have one concern, though. I understand you missed your appointment 2 days ago. What happened? Now, that immediately puts Mr. Jones, if he didn't believe it at that point, which he probably already does, oh my gosh, this authority figure in her black robe is paying attention to me personally, and there's a good discussion. So that really does have a powerful black robe effect on these individuals. And again, not every county is doing this piece of the puzzle. They may very well have people on AOT, and they are in fact making sure the person's getting good services, and often surrounding support services, which is really what ADM boards provide anyway. So we make sure we're at the table for this. But in Summit County, we have this added component of the New Day Court. About once a year since 2016, we've had an individual in court in front of the judge not doing well at all. And literally what will happen is she will ask, order, if you will, a sheriff's deputy to escort the person to PES, Psychiatric Emergency Services, could be to an emergency department as well, really with the expectation that this person's probably getting hospitalized. If they're that ill, they can't control their behavior and their thoughts in front of the judge, they're probably not safe to be in the community. So that has happened, but literally like once a year, if that even at this point. Most of the time, the individual is in front of the judge. It goes quite well, and the judge will say, and again, this is also something that's already predetermined by unless something goes strange in court, by the treatment team and the judge together in the background. I'll see a sir in about 75 days, meaning toward the end of that up to 80 or up to 90 days, whatever is remaining after the hospital. We have some in-between cases where the person looks okay, but not great, and the judge will say, I'll see you again in 2 weeks. 2 weeks because our New Day Court is every other Wednesday afternoon. Let me give you an offer. If you are interested, it doesn't matter what county you're from, if you're interested in observing New Day Court, let me know that I will arrange that. The judge is very happy to have people come to the court to observe it, and better than that, you can sit next to her on the bench. So you can actually see it from the judge's perspective, experience it that way. We have had people from other states, not just in Ohio, come and sit with her on the bench. I think now about 50 different arenas have come in, places have sat next to her and observed this and taking it back to other counties or other states and worked on this. So really, that offer stands for anybody who's listening today, but make sure you let me know and we'll work it out through the court. So you'll know the date, the time. They're usually Wednesday afternoons, starting at about 1:30, and literally probably an hour and a half from start to finish, right? This is very rapid, although enough time to get a sense of how each individual's doing with their AOT. So you can see here how effective it is. It is actually very effective. And for many people, the data shows, actually, including our own data that Dr. Mark Munitz, my predecessor, published way back in, I think, 2006 now, that it's really 6 months is the sweet spot. So in Ohio, I've told you it's up to 90 days. So what happens if you get to the end of the 90 days and Mr. Jones or whoever still needs more? The net result is that the treatment team can apply more paperwork, like an affidavit, to the probate court to extend this. That also, again, due process rights requires another hearing. So they hold hearings not every Tuesday, because we don't always have people being renewed, but if there is a renewal needed, then they will have it on a Tuesday morning instead of Thursdays. Those are booked, as I've told you in the other lectures, Tuesday morning at CSS. Again, very, very valuable that the judges, people, the magistrate, the attorneys, the attorney representing the client, et cetera, go to CSS. Kinder, gentler approach, still a very official court, but nicer for everybody, including the people who are testifying, that they think Mr. Jones or whoever requires more time on AOT. The law allows that extension for up to 2 years, which of course scares the patient. And I've personally had to go and talk to patients about this when they were very struggling at CSS around the concept. But it really, again, is not meant to impact them in any negative way as far as their freedom to be live where they want to live, be in the community, work their work, go to school, whatever they're doing, keep their relationships. It's not meant to impact that in any negative way. Many people are not renewed. They do quite well during that up to 90 days. But the ones who are renewed, we often expect at least a year. Now, let me say here, the judge can end AOT anytime she wants. She can end it. We could just have today extended it for 2 years, and a week from now, CS says, you know what? Whatever was going on, he's doing way better now, and they could ask, and the judge could end it right then. So it is always up to. It's never has to be. And so the patient can ask for that through the treatment team. Their family could ask for that. The judge herself could ask for that if she's seen the person in court a few times. And that's, why is this guy still on, or this, whoever he, she, or they is, why are they still on this commitment? So that can happen and does happen. So just be aware of that. This is not a sentence like criminal court. This is an up to, giving a window of opportunity for the patient and the treatment team to make very positive outcomes for that person. So just important to keep in mind. Let me show you a quick video of a graduate. I'm going to have to fast forward it here to the 34 minutes and 30 seconds point here, and I might not even show the whole thing, but just so you've heard somebody who's been on it, and then I'll touch base on the new potential law that's coming up, and then we'll take questions. Yeah, see if I can do this on here. I don't know how you do this. I'm not sure I can do that here. All right, well, I'll come back in about 40 minutes. I'm not sure. Never mind. We may have to skip this, and I apologize. I didn't know I couldn't forward an embedded video. It looks like I can't. Okay, well, I apologize. I didn't realize that my technology wasn't quite that good. I assumed I could forward to this. So, okay. Anyway, you can see that it's actually on the AOT website. So the Treatment Advocacy Center, that's where Betsy Johnson works, and actually Judge Stormer is now on their board of directors because of her excellent national work on this topic. So you can see here, if you went to the Treatment Advocacy Center, you can see videos of individuals talking about this, and you'll have the slides that I will upload that once I can get back onto the iEcho. I think today I joined by Zoom because I have a new computer here at ADM and have not updated all the passwords and so forth. So let me just mention real quickly then the law so that you're aware of this. So right now, the current law has this in it already. It's currently number 5. This would allow an individual, let's say you're treating the person, they start to have an escalation of their illness. You don't really want them to end up in the hospital. You could do an affidavit, or their family could. Generally, that goes through the probate court again. Somebody, a court investigator, will do an evaluation. They'll come out to the person's house often, whatever their residence is. If need be, they could go into a location, if that's easier for the patient. They will be evaluated. They have to meet these with pretty restrictive criteria. We think Judge Stormer and I agree on that. You'll notice that within 36 months, they've had hospitalization. Basically, within 48 months, there's an other violence or threats of violence, maybe even jail time. And these are drawn directly out of New York law. And the reason for that is that the attorney from the Treatment Advocacy Center at the time, who was working with Ohio, wrote or helped write at least the New York law. So this is drawn from that. This has not worked very well. Honestly, as I said, when this happens, it's generally families through NAMI. NAMI Summit County is one of the excellent branches around the state. And they have discovered that when the families, again, have a pretty high bar, right? They're used to their loved ones' behaviors. So when the time they think the person needs help, the truth is generally the court investigators have decided they actually needed to go into the hospital. So this is currently in the law as number 5. What's in play right now is to create a new number 5 and make what I just showed you number 6. And this would be a psychiatric deterioration standard. This did not pass in our legislature the last biennium, December, a full year ago. So we are now in the second year of the next biennium, and they do all the processes through the legislature this way. And there will be a big blitz starting in April. I think 4 different dates. NAMI will be there on one day, the OPPA, which is the Ohio Psychiatric Physicians Association, one day. I think the probate judges are going one day, and there's another group going another day to meet with legislators and say, hey, this would help our loved ones. This would help the citizens of Ohio. So this is an Ohio change if it is enacted. And what it basically is just, you can see the writing, but I'll just summarize it. The concept here is, let's say I've been treating Mr. Jones and I've treated him for a period of time, and I know that when he starts to say certain things, behave a certain way, or stop certain things, such as his medications, that within a few days, we're not talking weeks out, we're not that good at predicting anyway, but within a few days, I know he's going to meet one of the current 4 criteria on the pink slip, as we discussed in session 1 of this 3-part series. If he's going to meet one of those, I don't want to wait for him to hurt himself or hurt somebody else, which is commonly what happens before we get to bring somebody in on a pink slip. The goal here is to add a 5th criterion to our pink slip. So the 6th one I showed you is not on the pink slip, it's in the law. But this one would actually be added to the pink slip, the first change to the pink slip of any substance for decades. The only change actually in decades was 2018, when psychiatric nurse practitioners were added to the pink slip as automatic health officers. So really, this is the first language change to the criteria if this goes forward for decades. But it would allow you, if you know the person. So Mr. Jones, I've known him for years. I know when he starts to do certain things or stops doing certain things, that within days he's going to meet one of those first 4 criteria. And I know that he ends up in a fight with police, or he punches his mother, or whatever it is, bad outcomes that I want to avoid. I can use the 5th criterion, again, if it passes in the law. So you'll see here it's based on history. It's not the first time you see him. It's not your neighbor looks over and sees that you're not behaving right. That's going to require a standard pink slip. This 5th criterion, in the 4 criteria, this one by history is this deterioration. And then if that deterioration we know in the past has resulted in 1, 2, 3, or 4, right? Suicidal, homicidal, danger to self, not quite homicidal, not quite suicidal rather, and then would benefit from treatment, and without treatment will have one of these problems. So this is even a lighter shade of the rest. This is likely not going to lead to hospitalization. This is likely to help get Mr. Jones or whoever the person is back into care. That's the point. Let's get them into care, usually reconnected to care, because it's history. So we know that they've been treated somewhere, and maybe they were a CSS client or any of the other agencies out there across the state, and for whatever reason, they stopped coming. And we can't find them, and you can't track people down. We're not police, unless it's AOT, and then we can actually at least try to find them. So we're not going to find them. Well, now they've come back to attention of us or a police officer. If a CIT officer has known this person, been to their residence many, many, many times, he, she, they might also be able to use this 5th criterion, because they do know that when they've gone to the house like this, they're called back within 3 days for something worse. That would be when they can make use of this addition. So again, it's not passed through the legislature yet. It has been heard. There's been some proponent that is in favor of testimony already. I think Judge Stormer and Justice Stratton, former Ohio Supreme Court justice, have also testified now. And so we're hoping that the talking to the legislators will allow this to occur by the end of this calendar year. I will tell you that when we started this process, the probate judges started this at least 4 years ago. They pulled me into it probably 3 years ago now. So they probably started 5 years ago, pulled me in about 3 years ago. We've worked hard to make this happen. It didn't happen in the last biennium. We have a thought that it might go forward this time. And we will now, because of that delay, be like the 27th state to do this. We are not groundbreakers on this like we are with how we do AOT and so forth. The last thing I'll say is that the AOT, when I say that we're the best in the country, isn't me saying it. It's not Judge Stormer saying it. It's the country saying it. So the individuals who made the movie Bedlam, if anybody's seen that movie, I think it's probably on Netflix somewhere out there now. Those movie makers then said, this went really well. One's a psychiatrist, one's a movie maker. Said, man, let's do another movie. They asked around the country, what should we do? And everybody told them, you know what? Someone ought to do something on AOT. And then when they asked, where should we go? They apparently heard from a large group of people over many states, go to Akron, Ohio. I think that's pretty impressive. So, of course, they reached out to Judge Stormer. And so for the past several years, they've been here filming the movie. The movie's done in terms of filming. They're now working in the background on the 100+ hours of video, some of which they'll discard because people were in masks because they did this some during COVID. But that's a feather in our cap. And obviously, when the movie comes out, we'll make sure everybody's aware of it. And maybe we'll be able to do a free screening or something like that, at least here in Summit County, and maybe even somehow on the Echo. Of course, it'll be mostly the Judge Stormer show, but it will include some of our law enforcement, some of our excellent psychiatrists and other clinicians in the community in Summit County. So here's my contact information, as I think you probably all have by now, and I will take questions.